How to treat and cure brain tumor. In brain tumor care, different types of doctors often work together to create a patient's overall treatment plan that combines different types of treatment. This is called a multidisciplinary team. Cancer care teams also include a variety of other healthcare professionals, including physician assistants, oncology nurses, social workers, pharmacists, counselors, dietitians, and others. Descriptions of the most common treatment options for a brain tumor are listed below, including treatments that help manage symptoms. Treatment options and recommendations depend on several factors: the size, type, and grade of the tumor. Whether the tumor is putting pressure on vital parts of the brain. If the tumor has spread to other parts of the CNS or body. Possible side effects. The patient's preferences and overall health. Some types of brain tumors grow rapidly, other tumors grow slowly. Considering all these factors, your doctor will talk with you about how soon treatment should start after diagnosis. Treatment options include those described below, such as surgery, radiation therapy, and chemotherapy. Your care plan may also include treatment for symptoms and side effects, an important part of your medical care. For a low-grade brain tumor, surgery may be the only treatment needed, especially if all of the tumor can be removed. If there is visible tumor remaining after surgery, radiation and chemotherapy may be used. For higher-grade tumors, treatment usually begins with surgery, followed by radiation therapy and chemotherapy. Your exact treatment plan will be made by your healthcare team. Successfully treating brain tumors can be challenging. The body's blood-brain barrier normally protects the brain and spinal cord from harmful chemicals entering those structures through the bloodstream. However, this barrier also keeps out many types of chemotherapy. Surgery can be difficult if the tumor is near a delicate part of the brain or spinal cord. Even when the surgeon can completely remove the original tumor, there may be parts of the tumor remaining that are too small to be seen or removed during surgery. And, radiation therapy can damage healthy tissue. However, research in the past 2 decades has helped to significantly lengthen the lives of people with brain tumors. More refined surgeries, a better understanding of the types of tumors that respond to chemotherapy, and more targeted delivery of radiation therapy have lengthened lives and improved the quality of life for many people diagnosed with a brain tumor. Take time to learn about all of your treatment options and be sure to ask questions about things that are unclear. Also, talk about the goals of each treatment with your doctor and what you can expect while receiving the treatment. Learn more about making treatment decisions. Getting care for symptoms and side effects. A brain tumor and its treatment often cause side effects. In addition to treatment to slow, stop, or eliminate the tumor, an important part of care is relieving a person's symptoms and side effects. This approach is called palliative or supportive care, and it includes supporting the patient with his or her physical, emotional, and social needs. Palliative care is any treatment that focuses on reducing symptoms, improving quality of life, and supporting patients and their families. Any person, regardless of age or type and stage of cancer, may receive palliative care. It works best when palliative care is started as early as needed in the treatment process. People often receive treatment for the tumor and treatment to ease side effects at the same time. In fact, patients who receive both often have less severe symptoms, better quality of life, and report they are more satisfied with treatment. Palliative treatments vary widely and often include medication, nutritional changes, relaxation techniques, emotional support, and other therapies. You may also receive palliative treatments similar to those meant to eliminate the tumor, such as chemotherapy, surgery, or radiation therapy. Talk with your doctor about the goals of each treatment in your treatment plan. Some of the symptoms of a brain tumor can be severe and have an enormous impact on a patient's life. However, they can often be managed with the use of certain medications. Supportive care for people with a brain tumor includes Drugs called corticosteroids are used to lower swelling in the brain, which can lessen pain from the swelling without the need for prescription pain medications. Anti-seizure medication to help control seizures. There are several types of drugs available, and they are prescribed by your neurologist. Before treatment begins, talk with your healthcare team about the possible side effects of your specific treatment plan and palliative care options. And during and after treatment, be sure to tell your doctor or another healthcare team member if you are experiencing a problem so it can be addressed as quickly as possible. Learn more about palliative care. Surgery. Surgery is the removal of the tumor and some surrounding healthy tissue during an operation. It is usually the first treatment used for a brain tumor and is often the only treatment needed for a low-grade brain tumor. Removing the tumor can improve neurological symptoms, provide tissue for diagnosis, help make other brain tumor treatments more effective, and, in many instances, improve the prognosis of a person with a brain tumor. A neurosurgeon is a doctor who specializes in surgery on the brain and spinal column. Surgery to the brain requires the removal of part of the skull, a procedure called a craniotomy. After the surgeon removes the tumor, the patient's own bone will be used to cover the opening in the skull. There have been rapid advances in surgery for brain tumors, including the use of cortical mapping. This technique allows doctors to identify certain areas of the brain that control the senses, language, and motor skills. In addition, enhanced imaging devices give surgeons more tools to plan and perform surgery. For example, computer-based techniques, such as image-guided surgery, IGS, help surgeons map out the location of the tumor very accurately. However, this is a very specialized technique that may not be widely available. For a tumor that is near the brain's speech center, it is increasingly common to perform the operation when the patient is awake for part of the surgery. Typically, the patient is awakened once the surface of the brain is exposed. Then, special electrical stimulation techniques are used to locate the specific part of the brain that controls speech. This approach can avoid causing damage while removing the tumor. In addition to removing or reducing the size of the brain tumor, surgery can provide a tissue sample for biopsy analysis, as explained in diagnosis. For some tumor types, the results of this analysis can help determine if chemotherapy or radiation therapy will be useful. For a cancerous tumor, even if the cancer cannot be cured, removing it can relieve symptoms from the tumor pressing on the brain. Sometimes, surgery cannot be performed because the tumor is located in a place the surgeon cannot reach or is near a vital structure. These tumors are called inoperable. If the tumor is inoperable, the doctor will recommend other treatment options. Before surgery, talk with your healthcare team about the possible side effects and how they will be managed or relieved. Learn more about the basics of surgery. Radiation therapy. Radiation therapy is the use of high-energy X-rays or other particles to destroy cancer cells. Doctors may use radiation therapy to slow or stop the growth of the tumor. It is typically given after surgery and possibly along with chemotherapy. A doctor who specializes in giving radiation therapy to treat a tumor is called a radiation oncologist. The most common type of radiation treatment is called external beam radiation therapy, which is radiation given from a machine outside the body. When radiation treatment is given using implants, it is called internal radiation therapy or brachytherapy. A radiation therapy regimen, schedule, usually consists of a specific number of treatments given over a set period of time. External beam radiation therapy can be directed at the tumor in the following ways. Conventional radiation therapy. The treatment location is determined based on anatomic landmarks and X-rays. In certain situations, such as whole brain radiation therapy for brain metastases, this technique is appropriate. For more precise targeting, different techniques are needed. The amount of radiation given depends on the tumor's grade. Three-dimensional conformal radiation therapy, 3D CRT. Using images from CT and MRI scans, See diagnosis. A three-dimensional model of the tumor and healthy tissue surrounding the tumor is created on a computer. This model can be used to aim the radiation beams directly at the tumor, sparing the healthy tissue from high doses of radiation therapy. Intensity modulated radiation therapy, IMRT. IMRT is a type of 3D CRT, see above, that can more directly target a tumor, delivering higher doses of radiation to the tumor while giving less to the surrounding healthy tissue. In IMRT, the radiation beams are broken up into smaller beams and the intensity of each of these smaller beams can be changed. This means that the more intense beams, or the beams giving more radiation, can be directed only at the tumor. Proton therapy. Proton therapy is a type of external beam radiation therapy that uses protons rather than X-rays. At high energy, protons can destroy cancer cells. Proton beam therapy is typically used for tumors when less radiation is needed because of the location. This includes tumors that have grown into nearby bone, such as the base of skull, and those near the optic nerve. Stereotactic radiosurgery. Stereotactic radiosurgery is the use of a single, high dose of radiation given directly to the tumor and not healthy tissue. It works best for a tumor that is only in one area of the brain and certain non-cancerous tumors, but it can also be used when a person has more than one metastatic brain tumor. There are many different types of stereotactic radiosurgery equipment, including a modified linear accelerator is a machine that creates high-energy radiation by using electricity to form a stream of fast-moving subatomic particles. A gamma knife is another form of radiation therapy that concentrates highly focused beams of gamma radiation on the tumor. A cyber knife is a robotic device used in radiation therapy to guide radiation to the tumor target, particularly in the brain, head, and neck regions. Fractionated stereotactic radiation therapy. Radiation therapy is delivered with stereotactic precision but divided into small daily doses called fractions given over several weeks, in contrast to the one-day radiosurgery. This technique is used for tumors located close to sensitive structures, such as the optic nerves or brain stem. With these different techniques, doctors are trying to be more precise and reduce radiation exposure to the surrounding healthy brain tissue. Depending on the size and location of the tumor, the radiation oncologist may choose any of the above radiation techniques. In certain situations, a combination of two or more techniques may work best. Short-term side effects from radiation therapy may include fatigue, mild skin reactions, hair loss, upset stomach, and neurologic symptoms. Most side effects go away soon after treatment is finished. Also, radiation therapy is usually not recommended for children younger than 5 because of the high risk of damage to their developing brains. Longer-term side effects of radiation depend on how much healthy tissue received radiation therapy and include memory and hormonal problems and cognitive, thought process, changes, such as difficulty understanding and performing complex tasks. Learn more about the basics of radiation therapy on this website, or see the American Society for Therapeutic Radiology and Oncology's pamphlet, Radiation Therapy for Brain Tumors. Chemotherapy. Chemotherapy is the use of drugs to destroy cancer cells, usually by stopping the cancer cell's ability to grow and divide. The goal of chemotherapy can be to destroy cancer cells remaining after surgery, slow a tumor's growth, or reduce symptoms. Chemotherapy is given by a medical oncologist, a doctor who specializes in treating tumors with medication, or a neuro-oncologist. Systemic chemotherapy gets into the bloodstream to reach cancer cells throughout the body. Common ways to give chemotherapy include a pill or capsule that is swallowed, orally, or by intravenous, 4, injection placed into a vein using a needle, through a catheter or port, which are used to make injections easier. As explained above, chemotherapy to treat a brain tumor is typically given after surgery and possibly along with radiation therapy or after radiation therapy, particularly if the tumor has come back after initial treatment. A chemotherapy regimen, schedule, usually consists of a specific number of cycles given over a set period of time. A patient may receive one drug at a time or combinations of different drugs at the same time.